Alabama and the coronavirus.
The threat of COVID-19 is not over. We're still seeing the virus spread, and all of our people are susceptible to the infection.
A pandemic affecting our health, safety, and financial stability.
We need to go back to work now.
We've got to get our economy going and do it in a safe way.
If we don't actually test them and understand what the prevalence of the virus is, it certainly have a high risk of having the coronavirus infection reoccur again as we try to move forward.
Tonight, getting answers to your questions about COVID-19 and reopening Alabama.
Live from Birmingham, this is an Alabama Town Hall with Lieutenant Governor Will Ainsworth and Assistant State Health Officer Dr. Karen Landers.
Safer at home, Alabama's moving forward with plans to reopen parts of the state during this coronavirus pandemic. Tonight, we are getting answers to your questions about Alabama's response to the coronavirus emergency. Good evening and thank you for joining us. I'm Sherry Jackson from CBS 42 News in Birmingham.
And I'm Peter Albrecht, news anchor at WKRG News 5 in Mobile, along with Siobhan Bryan from WHNT in Huntsville on our social media desk. And you're watching an Alabama Town Hall with Lieutenant Governor Will Ainsworth and Assistant State Health Officer Dr. Karen Landers. As you can see, we are practicing social distancing to bring you this special program. It's aimed at keeping you informed about this coronavirus emergency. Tonight, Nexstar Media Group's 5 stations in Alabama are bringing you this 30-minute town hall to get answers to your questions about what's next for Alabama and the coronavirus pandemic.
And we're going to continue to take those questions live. I'm monitoring Facebook, Twitter, using the hashtag #AskAinsworth. Again, that's hashtag #AskAinsworth. And we're going to be asking your questions to our Alabama leaders live.
Now, we will tell you we did extend an invitation to Governor Ivey, but joining us today, Lieutenant Governor Will Ainsworth, he and the Assistant State Health Officer, Dr. Karen Landers with the Alabama Department of Public Health tonight. They are answering all of your questions about the road ahead for Alabama, questions about your health and your livelihood. As we move into a different phase in the coronavirus emergency in the state, we want to thank you both for joining us and just say that we did extend that invite to the governor to be a part of this town hall. Her office declined the invitation, saying the governor is getting a high volume of requests.
And while the governor is not here for the town hall, she did speak today with our State Capitol Bureau reporter Rashad Hudson. The governor issued today a new safer at home order.
Yeah, this plan laid out by the governor today is being called a measured approach. Now, some of the big 3 that are outlined in this plan are retail stores, beaches, and medical procedures. Now, as far as retail stores, they're being asked to operate at a 50% capacity rate and practice social distancing. Same for beaches. They're asking for no larger than groups of 10. And same with medical procedures. They will be required to practice strict social distancing as well.
My fellow Alabamians, let me be abundantly clear. The threat of COVID-19 is not over.
The governor said she's still evaluating whether close contact services like barbershops, hair salons, and nail shops can reopen. We expect that to come a little bit later. Back to you.
Right now, the Alabama Department of Public Health is reporting 6,750 confirmed COVID-19 cases, 242 deaths in the state. And as far as testing, 75,903 people have been tested for Alabama's population of 4.9 million. Testing is still not at the level desired by either state, local, or federal health officials. Lieutenant Governor Will Ainsworth, you moved quickly today to respond to the governor's announcement today and starting what you call the process to reopen Alabama responsibly. So I want to begin just with how responsible is it when the state has not met those 3 criteria that the White House talked about, particularly the 14 days of no decline in cases?
Yeah, first I want to commend the governor, Dr. Harris, for the thoughtful plan they put out today. When you look at it, I think obviously several things. 1, they got public safety in mind. 2, they got making sure that we reopen the economy and do that in a safely and responsible way. And I would argue even on the 14 days, it's all in how you interpret that. And I think when you look at that, we had 339 cases on April 9th. Since then, we've been falling every day. We've not had one day where we've had more than 339 cases. So it's all in how you interpret those guidelines as far as a decline in cases. cases, but we're definitely falling. Yesterday we were, a little over 100. And so, I want to say to everyone in Alabama, it's because of the hard work you're doing and practicing social distance, and that we're able to put in those things today. The governor was.
All right, let's ask the doctor about the timing. We all understand the economics. People are losing businesses, they're losing their jobs, and if they're working from home, they might be losing a little bit of their sanity, but we're still having 200 new cases a day, doctor. Is it too soon for removing any restrictions at this point?
Well, as we look at our data, and specifically if we look at the curve, this appears to be flattening out, it is reasonable for certain activities to resume in terms of what the governor has authorized. Again, certain activities within the context of continuing to maintain the social distancing and continuing to maintain the respiratory hygiene measures, and also persons that are at high risk. In other words, persons 65 years of age and older or underlying health conditions still need to take an extra precaution. And again, just to remind that the order does not stay at home any longer, but it says to be safer at home, which still indicates that we need to take all of the measures that we have been taking as we go out a bit more in public.
Lieutenant Governor Ainsworth, you tweeted a question on Sunday about an international company that you said can produce 600,000 tests per day and then get results within 3 minutes, $20 per test. What can you tell us about this company and whether the state is actively working to get that company here?
Yes, I bring good news about testing, and I can tell you the governor's office, Dr. Harris, is working hard. So not only that company, but we've even found additional companies. We found another company that can do 1 million tests a day that has that capacity. These are, when you talk to health officials, this is the same way it does the swab. You can get a 3-hour result on that. The other test I was referring is kind of the test where they actually, going to draw your blood.
Antigens.
And there's some, discrepancy on that. Is that accurate? But the test with the swab, so the issues have been, are you able to get the swabs? Are you able to get the materials to be able to actually process the test? This company has that 1 million a day. They're working in other countries. They're already starting to do this in the U.S. And so what's great about, the markets, they respond. And when there's a need, these companies have stepped up to the plate.
And so on the testing, though, if people, right now you have to be kind of screened to get a test, right? You can't, it's not an on-demand test. Is that something that would allow us to have, hey, I need to get a test, I can go get one, or you still have to be screened to get them?
Yeah, so I think Dr. Harris and the governor's office are working on a plan to where eventually, obviously, if you're working in a company and, you have somebody that tests positive, you can go in and test everyone around that company. If someone has, been potentially, you talk about tracing, right? If you've interacted with someone, you can get a test. And I think that's where this is going, to make sure that you have more access to tests, and that if someone is worried they've been exposed to COVID-19, they can actually go get a test. And that's going to be important moving forward.
And Dr. Fauci said today it would be like June 1st for the country to have that type of on-demand testing.
Well, as we told you earlier in the broadcast, this town hall is being broadcast across the entire state of Alabama.
Now we want to turn now to a question from our partner station, WRBL.
Hi, my name is Elizabeth White. I am a reporter with WRBL News 3, specifically with East Alabama. I'm talking Lee County, Chambers County, and Tallapoosa County, leading the state consistently when it comes to COVID-19 deaths. How is the Alabama Department of Public Health tracing infection and local hotspots? And if they are, and some of these cases can be linked, how can the Alabama Department of Public Health be more transparent with the media and with the public regarding specific hotspot locations?
Well, Elizabeth, thank you for that question. Certainly that is a very good question, and it is an area that from the beginning of the COVID-19 outbreak, we have seen more cases. And we've looked at this in terms of some common activities or some commonality that occurred early in this that allowed for more cases to be reported. Now, as you know, each case is investigated. And not only is the case investigated, but there have contact tracing to be done so that each person that is a very close, a household-like or intimate partner, or someone that's extremely close, again, as defined by the 6-foot distance for longer than 15 minutes, or again, other factors such as household, these persons are notified and placed into home quarantine in order to reduce the spread of this. So one thing that we have done specifically with this area is try to increase testing as much as possible, but also to specifically look at any other commonality as we go forward in order to provide this information. Now, you mentioned transparency with the media. Well, certainly we want to provide as much information as we can while also protecting the confidentiality of individual patients regarding this investigation. Thank you.
Thank you, Doctor. Let's check in now with Siobhan at our social media desk.
All right, thanks, Peter. This first question is for the Lieutenant Governor. This is from Greg up in North Alabama. He said, is there a contingency plan if the safer at home order leads to another spike in cases?
Yeah, so I can tell you the governor and Dr. Harris, are monitoring the results every day. And I think, going forward, what we've got to do is when you look at the, testing model, and it's a testing, tracing, quarantine model. But my opinion on this is, for instance, I can tell you Marshall County, which is my home, we had an outbreak in the poultry plants there. And so instead of shutting down the plant, the Department of Public Health's gone in, they worked with the officials, they're testing employees, they're putting in all kind of different measures from plexiglass dividing people where they're having their breaks, and they actually solved the problems that were going on there so this business could continue to operate and we could continue to have poultry throughout our country. That is what we've got to do moving forward. It's not so much that we just shut down an industry when they have a positive case or a business, but we find out what is the problem, let the Department of Public Health and the experts find that out and put in measures to prevent that. That's what I think this looks like going forward.
Absolutely. Thank you so much for that answer, Mr. Ainsworth. The following question is for Dr. Landers. This question came from Tiffany in Birmingham. She said, can you confirm all labs in our state are currently reporting all negative and positive test results? And if not, what's being done to hold the labs accountable and bring them up to compliance?
Well, Tiffany, thank you for that question. And certainly early on in the process, the Alabama Department of Public Health was the primary agency testing through our Bureau of Clinical Laboratories. But as commercial laboratories came on board, again, commercial labs are required to report a positive result to us within 4 hours, but they're also required to report their negatives. And early on, we were not capturing all the negatives. So we have reached out to commercial laboratories, clinical laboratories, again, entities that are outside of the Bureau of Clinical Laboratories to ensure that they provide us with their negative data. And actually, a few weeks ago, we had a laboratory that was transmitting negative data to us, and inadvertently, some of that was marked positive, so it required us to go back into the system and make a correction. But all that being said, we have reached out to the commercial laboratories, and I think if you can see from our testing numbers, we now are capturing the positives and many more of the negatives, and hopefully we will be able to capture all of the negatives to give us a better denominator. Thank you.
Thank you, Dr. Landers. And again, guys, I'm continuing to monitor your questions using the hashtag #AskAinsworth. I'm checking WKRG's, WIAT's, and WHNT's social media. And if you tweet or Facebook using the hashtag #AskAinsworth, I'll read your question live. Guys.
Go ahead and tweet them. Still ahead, we are still working to get you important information about the Safer at Home order in Alabama.
After the break, we will talk about the economic impact of the coronavirus and how much that's playing into plans to reopen parts of the state. You're watching an Alabama Town Hall.
watching an Alabama Town Hall with Lieutenant Governor Will Ainsworth and Assistant State Health Officer Dr. Karen Landers.
Welcome back, everyone, and thank you very much for joining us. And now we're going to take a viewer question.
Yeah, this question was sent into the CBS 42 newsroom from Birmingham, Alabama. Lynn Battle writes, if it is safe enough for Alabamians who are contracting and dying disproportionately of this virus to return to retail jobs, can we assume that it is safe enough for the well-paid members of the Alabama legislature to also return to work? And so, Lieutenant Governor, we're going to give you that one because you're in the legislature.
Yeah, absolutely. I was actually in the chamber today. We came in and, due to a rule that we passed, and we obviously want to honor Governor Ivey's order, which expires. And so we adjourned till Monday. We'll be back in Monday, and we'll be at work. And we're going to do our constitutional duty of passing the budgets. We're going to take up and finalize local bills, and then also look at a bond issue. But we'll be at work next week, and obviously, wearing masks, practicing social distance, where applicable, and making sure we do the work of the people.
And how applicable is it, though, in that small space where
you
all
tiny.
work?
Yeah, I mean, so in the Senate, where I preside, obviously it won't be a problem for us to spread out. I mean, it won't be an issue at all there, but we've got to make sure, people practice that, and, we're encouraging people to wear masks, and it's, important to make sure we also have a distance. And so, but we're going to do that and do it in a safe manner and make sure, the good thing today, I walked in, the entire staff, they had masks on and we're spread out. So, I mean, it certainly can be done.
And this question, I guess, is with for Dr. Landers, but also for you on the weight of the numbers and the testing. You said on this 14 days, it depends on how you look at that 14-day decline in numbers. So what's the percentage of public health and then just sort of the pressure that helps you say, it depends on how you look at those numbers? Dr. Landers, I want you to weigh in on this as well, but how can you say that? Are the numbers not the numbers?
Yeah, I mean, so I think the numbers are the numbers. That's my opinion, but I'll certainly defer to Dr. Landers. But, when I mentioned earlier, the numbers have been declining. If you look at April 9th, we had 339 cases. We've been declining since then every day. And so, I think obviously let her answer how she wants. But in my opinion, they're declining each day. Now, do some days you go up? Yes, but then you go back down. And that's encouraging.
But today, Dr. Harris and the governor said we've not met that 14-day decline. So, Dr. Landers, can you weigh in on that? That's what they said at that news conference today.
Yes, and actually, if you look at the numbers, you can see that on an average, we appear to be under 200 cases. But if you look at individual days, you can see that we do go up and down. And part of that function is getting laboratory testing into the portal or into the data system that we have. Now, I think another way to look at this is to look at the number of cases that we have that are what's called not epidemiologically linked. And what that really means is persons that do not know a person in their family or in their household or a close personal contact that they were exposed to, but rather a person that, again, has no known exposure, because that gives us an indicator of community transmission. So what we're also looking at is not only a steady decline, but a decrease in the numbers of cases, again, that are what's called epidemiologically linked or epi-linked. And I think that will give us a very good indication of how much COVID-19 transmission we have in the community. So you have to look at these numbers in context of several different ways in order to provide an interpretation.
So we have not met the 14-day decline, or yes?
We have not had a consistent decline that, again, continues to go downward. And again, we also have numbers looking at from the standpoint of an epidemiologic link or no epidemiologic link. We've not met those parameters yet, but we appear to be trending. And again, we need to monitor this data over more days to see where the trend is regarding the cases.
The governor took a big step today by opening Alabama's beaches, and this impacts the entire state. People love to go to the beach, and also it's a big revenue source, obviously, for the state of Alabama. But, Doctor, I want to ask you, the #1 market for people who go to the beaches in Baldwin County is the state of Louisiana. where they have a COVID-19 rate 3.5 times what we have here in Alabama. And actually, if you're driving on I-10 right now and you try to go into the state of Florida, you're being stopped and you're being told, if you're from Louisiana, to go quarantine for a period. So how wise is it now to open up our beaches knowing that so many people are going to be coming from Louisiana?
Well, I think if we look at the action in terms of opening the beaches, we still have to go back to the social distancing and the respiratory hygiene measures. Now, clearly, when the beaches are open, the order will still be in place for groups of 10 people or less. I mean, obviously, the less than 10, it depends on, how you want to look at that, but you really, really need to keep gatherings of people smaller. You also need to keep persons in a manner where they are having ability to social distance so that there will not be an increased number of people that are close by that can transmit this virus. Now, one other thing we have to remember is this is a respiratory droplet virus. So obviously, the closer the distance, the talking, speaking, coughing, sneezing, I mean, these are all ways to transmit this, but also to remind, if people are ill, they need to stay at home. And that is just one of the most important aspects of this that we can still continue to remind.
And I'll follow up with the Lieutenant Governor, your task force. How important were the beaches in that big financial picture in reopening the state?
Oh, it's huge. When you look at the revenue for our state, not only what that does for the region, but our entire state, it's huge. And we felt it was important, and certainly want to commend the governor and Dr. Harris for doing that in a safe way. The recommendations from our task force came from the locals there that know it best. It came from the mayor in Gulf Shores, came from the mayor in Orange Beach, the sheriff, and a lot of the recommendations that they had on how we could do this safely came from some stuff they're doing in Hawaii and just recommendations they thought would work practical. And I want to say this, there's an enforcement aspect. They're going to have law enforcement there, they're going to have, lifeguards, and that's important. But we've got to get the economy going. One of the things, when you look at what happened during the Depression, right, and suicide rate going up 50% after the stock market fell. And one of the things that I want to make sure we get across, that person that loses their life to suicide because they potentially lost their job or their business they've worked for, that life is just as important as somebody that lost their life from COVID-19. And we've got to have a balance of both. And so certainly want to commend the governor as well as Dr. Harris to do, to try to find a balance. And I think from a revenue standpoint, that's certainly important.
And so let me ask this, because that's an interesting way of looking at it. The governor has said, and I think you've said as well, that every community is not the same. You can't hit it all with the same type of requirement on what's going to open, when it's going to open, which types of businesses are coming. I think we're seeing that with what happened today. But when you place such a value on the life, so for local communities where there are hot spots, what is your advice for those places if they feel it is necessary in their communities to keep things shut down a little longer when state orders end up superseding some of those orders?
Yeah, I think what we've got to do going forward is what I talked about earlier and how we solved it. And, New York Times had Marshall County as one of the hot spots in the country. And we didn't solve that issue by shutting down the business. The way we solved that is bringing in experts, and I want to commend Dr. Harris and Dr. Landers and Department of Public Health. They came in and they're experts in this and made recommendations to the company how they could adjust. That's how we solve this going forward, where our economy keeps going, and we've got the experts in public health advising these businesses how they can open safely. And I think that's the balance we got to have in our state.
All right, thank you. And let's check back in now with Siobhan at the social media desk.
All right, so this next question is from Dexter up in Huntsville. He cites UAB Health and Policy Professor David Becker. Lieutenant Governor, this is for you. Dr. Becker authored a study reporting that expanding Medicaid would have yielded a $935 million increase in tax revenue, as well as a significant $20 billion economic stimulus. Seeing that the pandemic threatens the health and economic stability of all of us, why are we refusing much needed health care and economic stimulus?
Yeah, thanks for the question. I think when you look at Medicaid expansion in the state, one of the things you always hear is how you're going to pay for it, right? And so I'll certainly look at any proposal and consider it, just like I think anyone else in the legislature will, on how you could potentially, first, how are you going to pay for Medicaid? What are the benefits? And so I think any of that is something you can look for, but I think the question I've always heard, and something I've always and never seen a great solution on, is how do you make sure you pay for that? Obviously, that's even more of an issue now with the potential economic downturn. I mean, if you look at income tax, sales tax, it's going to be off. And so we've got to make sure we can pay for that, and there is an upfront additional cost.
I quickly want to ask the doctor a question. We're running out of time, but doctor, we hear about a second wave with COVID-19. What are the chances that this comes back in August when we're going back to school or getting ready to go watch college football?
Well, certainly we know that the virus is not going away, regardless of what our trends are. Our trends are showing that the actions that we have taken so far have worked. But again, it will be extremely important for us to carry out the measures to continue to have the numbers as low as possible until such time as we can have medical treatment or a vaccine. So at the moment, I do think that it is certainly possible to see a second wave. And part of our ability to control that risk is the personal and individual responsibility that every person is going to have in this regarding social distancing and respiratory hygiene measures.
Thank you, Dr. Landers. That is all the time we have tonight. I want to thank Lieutenant Governor Will Ainsworth and Dr. Landers for their time.
Have a great evening.